Today I'm going to pull back the curtain and I'm going to show you why Medicare Advantage PPO plans are the second most popular plan type of Medicare plans in the market today.
Showtime.
That's behind only the Medicare Advantage HMO plans. Because despite some pitfalls, the Medicare Advantage PPO may be the right type of plan for a large group of people.
Fits like a glove.
So in this brutally honest review, I am going to break down how PPO plans work and give you 3 reasons why they are so popular and also 3 hidden dangers that maybe your insurance agent never even mentioned to you about the PPO plans. And by the end of this video, you'll probably know more about Medicare PPO plans than 90% of beneficiaries and even many insurance agents.
I'm so smart.
Let's start with the basics. What exactly are Medicare Advantage PPO plans again? Well, PPO stands for Preferred Provider Organization, and they are a Medicare Advantage plan, and they're just behind the popular Medicare Advantage HMO plan. So to help you better understand how these work, let's take a look at the chart and show you the differences between an HMO and a PPO. As you can see here, with a PPO plan, you typically don't have to select a primary care doctor, unlike HMOs where it is almost standard for you to choose your primary care doctor first. We can see that with a PPO, you usually don't need a referral to see specialists, but you may need to request prior authorization for special treatments. Now, when it comes to premiums, there are several PPO plans with a $0 premium. However, you'll generally find that they cost slightly more across the board than their HMO counterparts. But here's the big kicker. With a PPO plan, you are not restricted to your plan's network of doctors and hospitals only. Unlike HMOs, which only give you cover in a network, except for in the case of an emergency, with a PPO, you can actually go to just about any doctor or hospital and have your plan cover you. I'll explain how this works in just a bit, but generally speaking, you'll have to pay a higher copay if you choose to get services outside of your plan's network. Now, there are perks. Again, HMOs generally have more perks than PPOs, but PPOs do have perks oftentimes. And finally, there is a limit or a maximum out of pocket that you would have to spend in a year. So that means that that's the most or the highest amount of money that you could possibly spend in a year on your plan before your insurance company takes over and starts to cover everything. PPOs usually have 2 maximum out of pocket limits, one for their in-network transactions and one for their out-of-network transactions. I'm going to show you how some actual plans do this in just a bit, but for example, you'll see that several plans with a $4,000 in-network maximum out-of-pocket limit may have a $7,000 maximum out-of-pocket limit for the out-of-network services. And that's what makes a PPO plan a PPO plan. It has the in and out-of-network option. There are usually fewer perks on a PPO plan than an HMO plan. But the big reason so many people choose these plans is that they want to have more flexibility when it comes to networks. But okay, now that you know what a Medicare Advantage PPO plan looks like, let's take a look at the 3 reasons why you should consider choosing this plan, and also the 3 dangers that you should be aware of for why maybe you should not consider this plan. The first and most obvious reason to choose a PPO plan is the extra flexibility that it gives. PPO plans solve one of the biggest concerns for people when they choose a Medicare Advantage plan, which is the network of doctors and hospitals that are in the plan's network. However, PPO plans, they do allow you to go out of network anytime, but at a higher cost, so keep that in mind. So if you're someone who lives in multiple areas or you travel a lot, you could find this to be super helpful for you. Also, you don't need to choose a primary care doctor, so you don't have to get referrals to see specialists either. With the PPO plan, if the specialist is in the network, you can call and make an appointment. But I have to warn you that even though your plan doesn't require referrals, a lot of specialists still do. They'll still ask you to get a referral from your primary care doctor in order to see you. So you take the sum of all that, and that makes PPOs a great choice for people who want lower costs, but more flexibility than an HMO. The second reason that you might choose a PPO is that it typically has lower costs than original Medicare or lower monthly premiums than original Medicare with the Medicare supplement. Now, as we saw in the simple examples that I showed you just a minute ago, you can generally get a very low cost service from a PPO as long as you stay in the network. Of course, if you have the option to go out of network, that's really nice when you need it. But if you want to save, you'll find plenty of ways to stay in network with a PPO because they typically have pretty large and expansive networks. Of course, I'm saying that as a generalization. We always have to look at what's available to you. Now, aside from that, the premiums on a PPO plan are much lower than if you chose going with a Medicare supplement plan. Yes, PPOs tend to have premiums more often than HMOs, but when you compare a PPO to a Medicare supplement, like a Medicare Supplement Plan N, which for someone 65 years old on average costs maybe $100 to $130 a month depending on where you live, or a Medicare Supplement Plan G, which at 65 is $150 to $170 when you're 65, but can go up to $300 or $400 a month as you get older. Well, based on those comparisons, you realize that you can save a lot in premiums with going with a PPO plan, particularly a PPO plan like the ones I've shown you that have a $0 premium. So that's why PPO plans often are the most flexible, low-cost plan type that there is today. Now, finally, there are perks. We like to call them perks here. Most people call them extra benefits, but honestly, what are they? They're the perks to your plan. PPOs usually don't have as many perks as HMOs, but you'll still find that many PPO plans already have extra benefits for dental, vision, and hearing, and these are things that original Medicare and Medicare supplement plans don't have. You'll also find that most PPO plans have built-in prescription drug coverage, so you don't have to enroll in a standalone Medicare Part D prescription drug plan anymore, or pay the premiums for that, and that's what you'd have to do if you were on Medicare with a Medicare supplement. Now, all in, you can think of a PPO plan as a sort of best of both worlds type of plan. You get mostly a low-cost plan with some of the perks of a Medicare Advantage plan, but you aren't restricted like you are with an HMO plan, and you don't have to pay the high premiums of a Medicare supplement plan. Now, before you run and get yourself a Medicare Advantage PPO plan, let me just warn you about 3 dangers of this plan first, because again, there's no such thing as a perfect plan in Medicare. They all have their upsides and they all have their downsides. The first danger of a PPO plan, and this is one that you probably will avoid just because you've watched this video, is that a lot of people think that they can go out of network and not have these really high costs. But in the example I gave you, it was 40% out of network. So can you imagine going somewhere and having a big procedure for $100,000 and finding that they billed 40% of that? Well, that's $40,000. Thank goodness you have a maximum out of pocket. And if your maximum out of pocket is $12,000, $13,000, then you're not going to pay the $40,000. You're going to pay the $12,000 or $13,000. But still, that's a lot of money to pay in one time. And someone who doesn't understand the in and out of network differences on their PPO plan can really get hit with that. So you want to know what the costs are with the provider you're going to and make sure that you're not surprised when you have a PPO plan. The second danger of a PPO plan is that even though you don't need to choose a primary care provider or get referrals from that provider to see a specialist, you still may be subject to prior authorizations for some things. Sometimes when you get an expensive treatment or a specialty treatment, your insurance company may need to still approve it first, and that's what a prior authorization is. Now, if you've been watching Medicare videos on YouTube, you've probably heard things like, Medicare Advantage plans will never approve your prior authorization requests. That's how they save money. Or Medicare Advantage plans are evil because they will deny your prior authorization requests until it's too late. Well, if you've heard these things, always remember that these guys are exaggerating hard. They're exaggerating because they really want you to sign up for a Medicare supplement plan because that's probably all they sell. That's what pays them the most commissions. And that's also the easiest thing for an agent to enroll you in is a Medicare supplement plan. That's not to say that you shouldn't consider a Medicare supplement plan. But the reality is that there are a few horror stories here and there, but the vast majority of prior authorization requests are approved with no problems. And if you have a good insurance agent, then they are there to help you through any authorizations that you have that go wrong. Now, a recent study by Kaiser Family Foundation, which is a nonprofit, showed that 92% of prior authorization requests are approved right away. And if you're part of that 8% that get declined, the study also shows that 83% of the time, you appeal that and the appeal ends up overturning the decision. So while prior authorizations are real and you need to be aware of them, don't listen to what greedy YouTubers are saying that scare you away from PPO plans because that's just to their advantage. Prior authorizations just aren't as bad as what they say. And what we find with prior authorizations is most of the time when they're denied, it's because the doctor didn't enter the right justification or give any justification for the procedure. Once that's fixed at the doctor's office, typically your insurance company is just fine and is going to approve the authorization. The third and final danger of choosing a Medicare Advantage PPO plan is that it can be difficult to switch from that to a Medicare supplement plan later. You see, Medicare supplement plans usually require you to go through medically qualified underwriting in order to get their plan. They'll ask you a bunch of health-related questions and ask if you have conditions like cancer or if you've had a recent heart attack or if you've been hospitalized in the last year or two. They'll also look at the medications that you're taking, and they could decide based on those things to decline you and you would not be able to get a Medicare supplement plan. However, there are exceptions to this. Like when you first enroll in Medicare Part B, you have a 6-month window when you can join a Medicare supplement plan, no questions asked, and you cannot be declined regardless of your health status. But outside that window, there are only a few special enrollment periods that you have that can help you to skip medically qualifying for the plan and sign up right away. So that's why it's really important for you to compare your plan options before you start Medicare. If you choose a Medicare Advantage PPO, always be aware that switching to a Medicare supplement plan later could be difficult. But enough talking. Let me show you exactly what an actual Medicare Advantage PPO plan looks like. Okay, we're going to start here on Medicare.gov. I am going to go to the Plan Finder, which is right here under Find Health and Drug Plans. I'm going to put in a zip code. Today we are going to use a zip code from Atlanta, Georgia. I want to look at Medicare Advantage plans, find plans. We don't get extra help for any of those things. Do you want to see drug costs? Not today. Normally we would, but not today. And this is going to bring up all the available Medicare Advantage plans in this area. So in this area of Atlanta, there are 68 Medicare Advantage plans available. Now you notice that it starts out with some HMO plans here, a Kaiser Permanente HMO plan, a Kaiser HMO POS. HMO POS is an interesting annotation. HMO means that it's the in-network HMO, but POS means there's a little bit of money that can be used out of network for point of service. So for example, if you want to get a second opinion out of network, you could, but it usually doesn't have enough coverage for you to do procedures out of network. Okay, let's go down, and now we've found our first PPO plan that's ranked here on the Medicare Plan Finder. This is the Aetna Medicare Essentials PPO. We're going to click on Plan Details, and we're going to investigate this a little bit. So first off, you'll see that this has a $0 monthly premium, and the health premium, drug premium, $0, of course. Let's go down a little more. Does it have a deductible? No, there is no deductible. So even though Medicare has a Part B deductible, it doesn't apply to this PPO. Does it have a deductible for drugs? Yes, it has a $590 prescription deductible. What's the maximum out of pocket? Well, $14,000 out of network or in and out, $7,900 in network. So you can see that it has the two different maximums and they are both quite high. Let's go down a little more. How hard would it or easy would it be to hit that maximum out of pocket? Remember, that's not a deductible. A maximum out of pocket is your worst case scenario. A deductible is what you have to pay just to get services. Okay, primary care doctor, in-network, $0 copay. Specialist, in-network, $0 to $40. So some specialists are $0, some specialists are $40. So in this case, visiting a doctor is not going to push you to your maximum. All right, for tests, labs, and imaging, we'll start with diagnostic tests and procedures. Think of this as something like a stress test for your heart. You need to do a stress test. How much will it cost? Well, somewhere from $0 to the maximum of $95. Now, if you go out of network, then you have to pay 40% of the cost. So if it's a $1,000 test, you're going to pay $400. If it's a $100 test, you'll pay $40. You're going to pay 40% when you're out of network. You'll see that that's the same almost all the way down. Lab services, $0 to $15 copay in network, 40% out of network. MRIs, CT scans, etc., $0 to $300 or 40% out of network. X-rays, $0 to $95 and 40% out of network. Now you notice it has the 0 to figure. Typically in plans like this, they will have some preferred providers that are 0. Or in some cases, they will have certain tests or certain labs that are 0. But you're seeing what the minimum is and what the maximum is for that category. Emergency and urgent care, you can see there, 110 and 45, those are covered everywhere. With hospital services, inpatient hospital stays have a copay of $298 days 1 through 7. So if you stay 1 day, it's $298. If you stay 7 days, it's 7 times $298. However, from 8 days on, it goes to 0. Now, that means that you could be in a hospital for a year, and the max you would pay is just for those first 7 days on this PPO. So again, this is not a scenario where you're going to hit that maximum out of pocket. But you notice that out of network, it's 50% per stay. So let's say you're going to go to a cancer clinic. In this case, you live in Atlanta, but you want to go to Cancer Centers of America in Houston, Texas. Well, that's not probably unlikely to be in this plan's network. It may be, but for this example, let's say that it's not. In that case, you have gone to a specialty clinic that's outside, or a hospital that's outside of your area, and you're going to pay 50%. Okay, skilled nursing facility, you see the copay there, days 1 through 20, it's $214 a day, 21 through 100, it's 0 per day, or 50% out of network. You see preventive services, etc. Let's click on View More Benefits and Costs, and let's go down to the drug coverage actually first. So you look at drug coverage, it does have a drug deductible, and then it's 0 for generics, 24% for brand names, 25% for non-preferred brand names, and 25% for the specialty tier. I would say if you're taking any expensive medications on this plan, you are definitely going to hit the $2,000 drug maximum out of pocket. $2,000 maximum out of pocket on your drugs is the same for all plans across the board. However, some plans have really strong benefits where you actually won't pay $2,000 to hit the maximum, but on this plan it appears that you would. Let's go down to extra benefits, because this is an interesting category to see how does this PPO plan compare in extra benefits. You'll see that it has hearing exams and a fitting and a hearing aid for prescriptions at a 0 copay. So this is something that Medicare.gov is not going to give you the details. That's part of the reason why you need an agent, and you don't want to just enroll yourself alone on Medicare.gov because you'll be missing so much information. For example, here, which hearing aid is available and what are the options? Is it a good hearing aid? Is it not a good hearing aid? Who's the company, etc.? You don't know any of that from this information here. But it's a pretty good benefit to say it is a hearing aid available at a 0 copay on a PPO plan. Let's look at dental. On preventive dental, you get an exam, a cleaning, fluoride treatment, and dental x-rays at a 0 copay. So it has a strong preventive dental benefit. Let's look at the comprehensive dental benefit. Well, it says 0 copay for restorative services, endodontics, periodontics, all kinds of things. So it has a comprehensive dental benefit. But looking here at Medicare.gov, the problem is it doesn't tell you how much that benefit is. You see that it says limits apply, plan limits. There may be limits to how much. Well, what are the plan limits? I sure wish I knew here, but unfortunately you won't get that unless you're working through an agent who has access to this plan. So sometimes we use Medicare.gov to identify the costs of drugs, etc. But when we want to see the details on a plan like this, we actually use the documents from the plan. In this example, we would look up this specific plan, pull up their specific documentation, and tell you exactly what your limits are. Because the limit on this comprehensive dental, it might be $500 a year, it might be $5,000 a year. We don't know until we look at the actual plan details. But it is nice to see that there is a comprehensive dental benefit in a PPO plan. Now let's go down to vision. You'll see that vision has also benefits from 0 copay for exams to 0 copay for frames. But you notice on the right it says limits apply. There are plan limits. Again, we don't know what those plan limits are. Typically what we see is that the plan limits for a PPO are going to be lower than the plan limits we would see on an HMO. But again, we would have to pull up this plan-specific documentation to get that. Again, this is a limitation of Medicare.gov. It just simply won't give you all of the information, and why we don't recommend going to Medicare.gov and enrolling. Okay, we're going to go back up to the top here and go back to our plan search and scroll down. This was the first PPO that we found, the Aetna Medicare Signature PPO. Let's scroll a little bit more and find the second PPO that is on Plan Finder for the example here. Again, there's 68 plans. Medicare.gov is tossing them up there. It doesn't mean that this is the right order for you to choose a plan. This is the United Healthcare AARP Medicare Advantage Patriot No RX plan. This plan, when it says no RX, that means it has no prescription drug coverage. And if you enroll in this plan, you will not have coverage for prescription drugs and not be permitted to purchase a prescription drug plan. So this plan, we would say, is only for people that have existing drug coverage. And the reason why it says Patriot is typically these plans are made for people that have VA or veterans coverage. So I'm not going to use this one for my example because it doesn't have drug coverage. So let's scroll a little bit more, and we come to the Clover Health Valor PPO. Based on the word Valor, again, I am guessing that this is a PPO made for people with veterans coverage and that it does not have drug coverage. So let's keep going a little farther, and here we found the Clover Health Live Healthy PPO. this is what we will use. So let's go to plan details. At first glance here though, we can see plan benefits. It has a lot of coverage, X on transportation. So this plan will not help you get to and from a doctor's office. Click plan details and let's dig in a little bit. Okay, we're here in the overview and the first thing we see is the plan premium is $0. That means that this plan does not charge more than $0. I can't say that it's free, that's not permitted. It is a $0 premium plan. You see the standard Part B premium, $185. That is what most people pay to have their Medicare Part B. It doesn't mean that you pay that for this plan. You're already paying or have Part B paid for and you pay a $0 premium for this plan. Deductibles, 0 and 0. Now the maximum out of pocket. This one has a $12,999 maximum out of pocket for in and out of network. And it has a $7,999 maximum out of pocket for in-network. Let's go down and look at how you might hit that maximum out of pocket. You will see that it would be very hard to hit your plan's maximum. The primary care doctor visits are 0. And out of network, they're also 0. So you can have an out-of-network primary care doctor on this plan and have a 0 copay to see them. Specialists are $10 for in-network and $15 for out-of-network. So you can see how this, compared to the other plan we looked at, instead of having a percentage for your maximums, this one has some copays. So that could be very positive if you're planning on going out of network. We scroll down to tests, labs, and imaging, diagnostic procedures, 0 to 200, in-network, or 0 to 400, out-of-network. Again, I like things that are capped over percentages because it's more predictable. Radiology services like MRI and CT scans, 50 to 200, or 80 to 400. X-rays, 20, or out-of-network, 60. And then you see emergent and urgent care, 125. That follows you everywhere, and you're always covered for that as it says. Okay, if we look at hospital services, it's $310 days 1 through 6, and then 7 through 90, it's 0. And then out of network, it is $410 days 1 through 6. So if you were planning on going out of network to a hospital, then you can see it would be important to choose the right plan. One PPO would charge you 40% out of network, where the other one would charge you $410 for days 1 through 6. That's a big difference if you're planning on being out of network. Okay, we've looked at that. Let's go down and click on View More Benefits and Costs and look at the extra benefits that are stated in this plan. Here we have drug coverage. It looks very similar to the other plan on the generics, but on the brand names, $47 copay and a $100 copay on non-preferred brand names. So depending on where your copays fall, of course, when we work with you, we run your prescriptions. So we put all your prescriptions into the system, and it forecasts how much your prescriptions are going to cost for the year. And in that case, we would be able to tell you, if you first look at this, you'd say, oh, $47 and $100, this would be a better plan for me. Well, not necessarily. It depends on the plan's formulary, which prescriptions are covered, which tier they put the prescriptions in. Because what is preferred brand name on this plan might be a non-preferred brand name on another plan. So we really have to look at each plan and run your prescriptions. But let's go down as we were going to the extra benefits. What are the extra benefits that you can expect in this PPO plan? A fitting and evaluation. Your prescription hearing aids have a cost on this plan from $6.99 to $9.99. Over-the-counter hearing aids are not covered. What about dental? Well, your preventive, pretty standard. It's got exam, cleaning, fluoride, x-rays. You find that to be a very common benefit. But what about comprehensive? Well, in comprehensive, it says that it's a $20 copay for most services. For periodontics, it could be a 50% coinsurance. For prosthodontics, a $20 copay, and maxillofacial, a $20 copay. You know, I like to look at dental benefits just to try to say these words. But the point is that this also has limits, and we don't know what the plan limits are. But it does have a comprehensive dental benefit. So the perks are there. But how do they compare to the HMO? Well, it depends. What we typically see is that the PPO will have a lower plan limit and the HMO will have a higher plan limit. But again, you have to look at the specifics of the plan. And unfortunately, Medicare.gov doesn't give us that level of detail. But this gives you an idea of what a real PPO, these two examples are from Atlanta, Georgia, what they actually look like and how a PPO might look in practice. Now keep in mind, and I always have to give my disclaimer, these are just two examples of PPOs from one specific zip code in the United States. There are thousands and thousands of plan options across the entire country, so we have to look at what's right for you. And the Medicare Advantage PPO plans that are available in your area may vary greatly from what you just saw. So in some areas, the PPO plan options are fantastic, where in other areas you have very limited choice, and in some parts of the country, particularly in the more rural areas, there will be no PPO and no HMO options. And that's my brutally honest review of how Medicare Advantage PPO plans work. So again, I think of it as the best of both worlds. It's good for those who want the flexibility of a Medicare supplement plan with access to doctors and providers, but also they want to have some perks like you get with the Medicare Advantage HMO plan, and they're avoiding some of the high monthly premiums of a Medicare supplement plan. So if you want to find if there's a PPO, like the actual PPOs that are available in your area, you can call or text our team of licensed insurance agents here at PlanFit at 877-360-6565, and we are happy to assist you at no cost to you. If you haven't already heard this, our team of licensed insurance agents are paid salaries. They are not commissioned, so they don't make any money to push one product or another or to get you to sign up for this or that. They're just here to help you, and will even tell you about things and plans that are available in your area that pay no commissions at all. Also, if you'd like to learn more about your other plan options, I created brutally honest reviews for the Medicare Supplement Plan N and G, so go and check those out. That's it for today. Thanks for watching, and I'll see you on the next one. Bye-bye.